بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. We continue with you in this course through some chapters that we can cover during this pandemic, let's say, and we hope that to see you again in the classroom. But I hope the online courses will work for you and for everybody who's wishing to learn about this material. Now we continue with chapter 3, pre-exercise evaluation. This is related to the evaluation that must occur before initiating an exercise program. And this chapter actually is a bridge between several chapters of this text, like the chapter that was presented in chapter 2 about the pre-participation screening, and another chapter will be the next chapter actually, which is the fitness assessment and the clinical exercise testing concepts. So this chapter works as a bridge between those chapters. And if you remember from the previous chapter that some individuals who were screened with the pre-participation screening questionnaires were classified as like at high risk, low risk, or moderate risk, and some of them, especially the individuals at high risk, were referred to further medical clearance before starting their exercise program. So this chapter basically will talk about the tests and examinations that are required for individuals at high risk for most of the part, and also it is adapted for tests and examinations that will be warranted for other individuals at low and moderate risks. So in this chapter, there will be an abbreviated versions of the pre-exercise evaluation appropriate for low and moderate risk individuals wishing to engage in light to moderate intensity exercise within health fitness settings. Also, this chapter includes a more intensive medical evaluation for subjects who are at high risk. So you will see that there is an overlapping between the tests and examinations between the individuals at the different classes of risk. Now, a comprehensive pre-exercise test evaluation will include a medical history, a physical examination, and laboratory tests, let's say lab tests. A pre-exercise evaluation that includes physical examination, an exercise test, or lab test might be warranted for lower risk individuals for some reasons, like despite they ended up with low or moderate risk, the exercise professional, like let's say who will supervise their exercise training or their exercise rehabilitation, if they have some other concerns, he may require some lab tests, some exercise testing, some physical examination. In cases such as he has, the exercise professional, he has some other concerns about that individual's cardiovascular disease risk. Maybe that individual who filled that questionnaire, the pre-participation screening questionnaire, he reported several risk factors from the cardiovascular disease factors. Though he did not report any of the symptoms, any of the diagnosed cardiovascular diseases, any of the signs and symptoms suggestive of cardiovascular diseases or pulmonary or metabolic diseases, still that exercise physiologist or professional, he has some concerns about those cardiovascular disease risks. Also, he may require these tests and examinations for him to design a proper exercise training program and exercise prescription for that specific need of that individual. Because when he has the baseline measurements, the baseline results for that particular individual, this will substantially help him in designing the most appropriate exercise prescription for him to improve the results or the capabilities and the cardiovascular capacities of that individual. Other cases that these tests and examinations will be required for individuals at low or moderate risk, if the subject himself, the participant himself, he has some other concerns other than what he was asked in the pre-exercise evaluation questionnaires. So he may require another or other medical evaluations. Now let's say, let's start with the medical history and what are the components of the medical history that he will be asked about. This is actually questionnaires, questioning and questioning and questioning about all of these components, such as medical diagnosis, if he has had any previous physical examination findings, and the exercise professional or the physician maybe, he may need them for further investigations and further health inspection of that individual. Also, he will be questioned about symptoms that if he has had in the past, these symptoms may be related to his pulmonary function, to his heart function, to his like chest pain, coughing, wheezing, breathlessness, the same or in more details like the symptoms and signs that we have covered in the previous chapter. Also, if there is any recent illness or hospitalization, or if he has had a recent surgical procedure, or he has been recently diagnosed with a medical condition, he will be questioned about orthopedic problems, any injuries, any limitations in his skeleton, such as tendons, ligaments, joints, muscles, bone fractures, any orthopedic problem that may limit his physical activity. If he's taking any medications or supplements, or if he has some drug allergies, if he will be asked also about other habits, like how much caffeine he's taking a day, if he's like alcoholic, or if he even drink alcohol, or if he smokes, if he's under drug use. All of these will help in like a very good evaluation of the condition and status of that individual. The exercise history, like if he's an athlete, if he has been an athlete, if he was an athlete before, if he was involved in exercise program and training for a period of time, a year, 2 years, 3 months, 6 months, what kind of exercise he was involved in, such as resistance exercise, aerobic exercise, running, cycling, about work history, and about family history as well. If he has, for example, a first-degree relative who passed away before the age of 50 in a heart attack, if he was a man, or if a first-degree relative woman, if she perished in heart disease before the age of 60, or any of the family has diabetes mellitus or pulmonary condition. So he will be asked about all of these things in the medical history questionnaires. Now let's go to the physical examinations. The good physical examination will include the following. The first thing and the easiest thing is to determine the body mass index. The body mass index by determining or measuring the body weight and height. So this will be calculated as the body weight kilogram over the height by meter square. So we will get the result here. And also to measure his waist circumference by measure tape, and we will take that in the next chapter, inshallah, how we would perform these examinations. Based on the body mass index, based on the waist girth and other procedures, we can determine whether he's an overweight subject, if he's obese, if he's at high risk of developing cardiovascular diseases or metabolic diseases, and also with other procedures such as the skin fold method, that we can determine through that method the percent body fat. And all of this information can tell us at which level of risk that individual at. Apical pulse rate and rhythm. This is at the apex of the heart. So this is the heart, let's say, this is the apex. So using the stethoscope, the physician or the professional, the personnel that he is required to do these examinations, he will have the stethoscope at this point on the chest, of course, and detect the rate and the rhythm of the apical pulse, we call it. The resting blood pressure. The resting blood pressure, to measure the blood pressure, of course, but in different positions, like during a seated position, during supine position, which is laying down on your back, and a standing position. Of course, with each position, the blood pressure will be changing. So it's good to determine the blood pressure at all of these positions as a baseline measurements, of course. The auscultation of the lungs. The auscultation is to listen, okay, to listen to the lungs uniformity, to the sounds that arise from breathing, such as wheezing, such as like paradoxical breathing. The palpation of the cardiac apical impulse and point of maximal impulse. Also, this will be a palpation at this area, the apical impulse, we call it. The auscultation of the heart with specific attention to murmurs. Murmurs, as we explained before, these are the sounds of the blood flow in the heart and around the heart. So we have chambers in the heart, so the blood flow from chamber to chamber, okay, it produces sounds. We call it murmurs, and it should follow a specific rhythm of sounds, and the physician may detect and abnormal sounds of the blood flow in the heart and around the heart that may indicate something's wrong in that heart, or a valvular disease, a leak in between the chambers, and this will affect the cardiac function so drastically. And also from the physical examination, the palpation and auscultation, to listening to the carotid, abdominal, and femoral arteries. This is also listening to the sound of the blood flow in these arteries. These are the names: femoral in the thigh, in the leg, and the abdominal in the abdominal area, and the carotid, it's in your neck. So this is part of these physical examinations. I know it's two medically terminations, but let's say just focus here on the resting blood pressure, the body weight, and body mass index. These basically for you to know what kind of physical examination the individual has to take. This is, as we mentioned earlier, that also the subjects at low or moderate risk, they may undertake. A continuation for the physical examination to evaluate the sounds in your abdominal, the bowels, if there is palpation of any masses, any solid pieces in your abdominal area, any tenderness in that area too. Inspection also of lower extremities for edema. Edema if there is any swollen feet. Also to palpate the arterial pulses in the lower extremities. Lower extremities meaning the legs basically, and the feet. If you remember that edema or feet swollen, if they are swollen during the night, this is a sign and symptom of heart disease. If one of the feet is swollen, this is a sign of deep thrombotic clot. So this will be examined too. A follow-up examination related to the orthopedic or other medical conditions that would limit exercise testing, like what's the condition now of a torn ligament, of a fractured bone, of an osteoarthritic joint. So what's the condition at the moment, and how it is healing or rehabilitating. Neurologic functions such as reflexes and cognition, reflexes such as the knee reflex test, like when the doctor or the exercise professional, he hits on this tendon and the subjects must show a reflex. This is not like intentional, but to show the neurologic reflex. Inspection of the skin of the lower extremities, especially with the patients with diabetes mellitus. Now let's go to the lab tests. These can be performed for individuals at low to moderate risk. First, the fasting serum total cholesterol, the LDL, the HDL, and triglyceride. All of this we call it lipid profile. Lipid profile. The fasting means that individual, he has to fast to overnight like to report to the laboratory after an overnight fasting for 10 to 12 hours. Because if he had a breakfast before these tests, all of these results will be changing. So he has to report with at least 10 to 12 hours of fasting. Of course, longer fasting will affect the results too. So the standard fasting period is 10 to 12 hours. And also in the morning, it should be tested mostly because there is a difference between morning and evening tests for these parameters. The fasting plasma glucose, though it is a very simple test, after 10 to 12 hours of overnight fast, to test the fasting plasma glucose. This can tell us whether the subject is diabetic or pre-diabetic or at normal levels of blood glucose. This test will be more emphasized in individuals if they are aging over 45 years old, or if they are younger but they are overweight, like the body mass index, as we mentioned earlier. If they have the value of BMI, the body mass index, over 25 kilogram per meter square, they are overweight. If they are over 30, they are obese. So even if they are younger than 45 years old, but they are overweight or obese, this test, the fasting plasma glucose, is more emphasized to be conducted in these individuals. Other individuals that have to take this test, if they have risk factors for type 2 diabetes mellitus, such as a first-degree relative with diabetes, or if he's among one of these ethnicities, like if he's an African American, Latino, Native American, Asian American, Pacific Islander. If she's a woman and she experienced a gestational diabetes during her pregnancy. If the subject is hypertensive, he has a high blood pressure, 140/90 or more millimeter Hg in adults. If they have low levels of the HDL is the good cholesterol. We need it at higher quantities in our blood. If the individuals have lower levels of this kind of cholesterol, so this test is more emphasized because it is a risk factor actually to develop diabetes. If they have triglycerides at higher level than 150 milligram per deciliter. If they were previously identified as with impaired glucose tolerance or impaired fasting glucose. This is basically if they have taken the test before and they showed bad results, like if they showed or they resulted in high fasting plasma glucose. So they are actually at risk, so they have to redo it again and again. And if they are habitually inactive, don't do enough exercise, if she's a woman and with polycystic ovary disease, or the individual has a history of vascular diseases. Other lab tests includes the thyroid function as a screening evaluation, especially in dyslipidemia, if dyslipidemia is present. Dyslipidemia means they have a high lipid profile. They have a high total cholesterol, high LDL, low HDL, and high levels of triglycerides. This condition is called dyslipidemia. Now about the tests or the lab tests for individuals at high risk. In addition to all the preceding tests that might be appropriate for the low and moderate risk individuals, they may take them all. In addition to that, they will take other tests such as resting 12-lead ECG. This is the echocardiography. The Holter monitor. The Holter monitor is actually a small device that will be attached on the chest of the subject with leads, but fewer leads than the 12-lead ECG. The physician may require this for that specific individuals because this test, the resting 12-lead ECG, is very brief, is like performed during a short time, but this Holter monitor will be attached to the patient for longer time, for 24 to 48 hours. Because your doctor may require this to see the heart function on a long-term basis. The symptoms and signs of the cardiac function sometimes may disappear. Sometimes it comes all of a sudden during the day. So the resting 12-lead ECG may not give you that information. So the doctor may give you this to monitor your heart on a longer period of time to see any events if they develop during the day. Coronary angiography. This is a procedure that uses a special dye called contrast medium and to X-ray your heart. This can tell the blood flow on your coronary arteries of the heart that's supplying the cardiac muscle. And other tests like echocardiography. The echo is called sometimes using the ultrasound machine, and the exercise tests as well. Carotid ultrasound and peripheral vascular studies. Also to consider measures of lipoprotein, high sensitivity C-reactive protein. This is to show the levels of the systematic inflammatory response of that individual. The LDL particle size and number. This is different than the general LDL test in the lab tests because this shows how big is the LDL particles. The LDL particle contains lipids inside them. Okay, the particle may be containing a large amount of lipids or a smaller. You may think the bigger is the worst. Actually, as we go to smaller sizes of the LDL particles, these can penetrate the endothelium of the arteries and precipitates and accumulates in the vessel walls, and this what makes the artery narrowed and narrows the passage of the blood flow. And with building up of these particles, this passage will be too narrow and may develop like the clot in these arteries. Also, from more specialized tests, the HDL subspecies, especially in individuals with a strong family history of premature cardiovascular diseases, and in those individuals without traditional cardiovascular disease risk factors. Chest radiography, basically this is the chest X-ray, a comprehensive blood chemistry panel and complete blood count as indicated by history and physical examination. Again, this is to medically termination. Let me say, focus on the difference between Holter monitor and the resting 12 lead ECG. Chest radiography, just to know that it is a chest X-ray, and that's it. And the others just for your own knowledge. The lab tests for patients with pulmonary diseases, to conduct for them a chest radiography, pulmonary function tests, carbon monoxide diffusing capacity, and blood gas analysis, or like oximetry, for your own knowledge again. Let's now focus on one of these physical examinations, which is the blood pressure. This is an integral component of the pre-exercise test evaluation. For you to decide whether you have a normal or high blood pressure, the blood pressure measurement should be taken in seated position during several readings, recorded during 2 or more office visits to the doctor. It's not like you're eating and let's go ahead and measure our blood pressure, or if you are walking around or you are doing some physical activity, you are working at the home, and then you test your blood pressure. This is not like an accredited reading, because blood pressure changes with any movement. Actually, it changes with nutrition, changes with whether you have had your meal or not, whether how you are sitting. Actually, are you having a cross-legged? You are standing. You are laying down. You are sitting. You are holding some weights. You are cold, you are hot, because it changes with all of these conditions actually and circumstances. So for you to decide your accurate and valid blood pressure, this should be measured during 1, 2 or more office visits, and the doctor will let you to have seat for a few minutes, 10 to 15 minutes or maybe more, to get all of your body systems relaxed and in rested position, for him to give you the resting blood pressure measurement. This table shows the classification and management of blood pressure for adults. The BP here, it means blood pressure classification: normal, pre-hypertension, stage 1 and stage 2 hypertension. The SBP, the systolic blood pressure, which is the top reading of the blood pressure measurement. The diastolic, the BP, diastolic blood pressure, the bottom reading. Here we will be talking about lifestyle modification. If that individual with these classifications are required to modify their lifestyle or not. Now for normal classification, the top reading, the systolic blood pressure, should be below the 120 millimeter Hg, and the diastolic blood pressure should be below 80. Lifestyle modification always encouraged. Lifestyle means like the nutrition, the physical activity, the sleeping habits, like alcohol, caffeine, drug use, all of these. If there is any intake from these things, should be modified in order to protect the blood pressure measurements and parameter in your body. A pre-hypertension class. This is a stage before the subject gets to the hypertension class. The top reading 120 to 139, 120 to 39, or focus here, or 80 to 89 for the diastolic blood pressure. So whether you have this reading in this range, though you have this like in normal range, like let's say here you have 79, but you have it here at 125, you are at a pre-hypertension class. Or vice versa, like if you have it here 85 and here 119, you are at the stage of pre-hypertension. Lifestyle modification, more emphasized. Yes, you have to. But in this stage, no anti-hypertensive drug indicated. Like you're not required to take drugs to lower your blood pressure. Just modify your lifestyle, and hopefully you get by time in the normal range. Stage 1 hypertension, like if you have your systolic blood pressure between 140 and to 159, or again 90 to 99, of course lifestyle changing and modification is like highly required, and he may take in this stage an antihypertensive drug. Stage 2, which is the most dangerous stage, is for the systolic blood pressure 160 or more, and the diastolic blood pressure 100 or more. Again, there is or here. Like if you have it here even normal, 119 or 120, let's say 119, you have it at normal level, but here you have it 101, you are at a stage 2 hypertension. In this case, of course, you have to absolutely, you have to have lifestyle modifications, and in this stage you may take a 2-drug combination for most of the individuals. This is a more recent classifications of the blood pressure from the American Heart Association. Now you can see the ranges are lower than the previous standards. Now the normal blood pressure range still the same. Your high, see here, your high or the top reading should be lower than 120, and your bottom reading should be lower than the 80 millimeter Hg. Now the recommendations, health lifestyle choices and yearly check, like you have to check your blood pressure every year. If you can recall with me, not to know your blood pressure is a risk factor, because mostly in most of the cases the blood pressure does not have symptoms to show up. So you have to keep checking your blood pressure to keep tracking your how you are functioning. And of course, the healthy lifestyle, you have to take the healthy lifestyle choices. Now, if you are at elevated blood pressure level, which is the pre-hypertension in the previous slide, here if you have it between 120 to 129, 120 to 129, and this should be lower than 80 millimeter Hg. There is a difference between those standards and these standards. The 120 to 129 was 140 actually in the previous slide, 130 to 139, but now it is from 120 to 129. And you have the diastolic blood pressure at the normal range. But if you have a systolic blood pressure over 120 to 129, you are at elevated blood pressure or pre-hypertension. The hypertension stage 1, or here it's called high blood pressure stage 1, 130 to 139, or 80 to 89. Here, the one who has this level of blood pressure, he has to take a heart disease and stroke risk assessment every 10 years. If less than 10% risk, lifestyle changes, he has to go through lifestyle modifications, and he has to take a reassessment in every 3 to 6 months. If higher, lifestyle changes and modifications with monthly follow-ups until blood pressure controlled. So we have to get the blood pressure under control. See the stage 2, which is the most dangerous stage here. If you have it over 140, compared to the previous standards that was 160. Now, if you have it more than 140, you have a high blood pressure stage 2. Or like even if you have this one normal, but if you have it over 90, you are at a stage 2 of hypertension. In this case, you have to take 2 different classes of medicine. You have to modify your lifestyle. You have to check your blood pressure every month until you get it controlled with these medicines, with the lifestyle changes. So basically you have to return it to the normal levels up to here. Why we focus on the blood pressure? Because there is a strong relationship, a strong association between the blood pressure and the risk for developing cardiovascular diseases and events. This association is continuous, consistent, and independent of other risk factors, like whether you smoke or not, whether you are with family history or not. This is an independent risk factor that is strongly associated with cardiovascular events, like stroke, like cardiac dysfunction, cardiac hypertrophy. See here, for individuals in the age of 40 to 70 years of age, each increment of 20 millimeter Hg in the systolic blood pressure or 10 in the diastolic blood pressure doubles the risk of cardiovascular disease. So, what are the life modifications that we were talking about? As an antihypertensive therapy, first the physical activity. You have to get more physically active. And we will talk about the recommendations or the minimal recommendations about how much physical activity you should perform in a day, in the week, how long, the durations, the intensities in the next chapters, inshallah. You have to reduce your weight if needed. Of course, if you are overweight or obese, which is more dangerous actually, based on your BMI or body fat percent, you have to reduce your body weight using the exercise, the physical activity, plus the diet strategies. The DASH eating plan. This diet plan, you should eat more fruits, more vegetables, more low-fat dairy products, and reduce content of saturated and total fat. This one and this one, the low-fat dairy products and the higher materials of saturated fat, if it was from like natural things such as milk, meat. Actually, if you take milk, like a full fat milk, or dairy products in general, meat, like with saturated fats, I mean, it was found that people with higher intake of saturated fats from these products, the dairy products, actually are at lower risk of developing cardiovascular diseases. This is an important point in this plan to reduce the dietary sodium. Like the canned food is highly saturated with salt actually, so you have to avoid these products. And also moderation of alcohol consumption. Actually, not moderation, is to a complete cessation of alcohol consumption. It was found that there is no minimum amount of safe alcohol. So any amount of alcohol is associated with increased risk of developing cardiovascular diseases, metabolic diseases, and other diseases. Okay, these tables and following 2 or 3 tables, just for your reference. If you have taken any of these tests, lab tests, you can compare to these tables whether you are at the like normal levels or at the borderline high or very high levels, and then you work accordingly based on your results. The same for the metabolic syndrome criteria. The metabolic syndrome, this includes about the body weight. Actually, if you have a body mass index over 30, and we will take these measurements later in the next chapter about the waist circumferences and the ratio between the waist circumference and the hip circumference. If we have greater ratio than 0.9 or 0.85 for men and women respectively, this is one component of the metabolic syndrome criteria. If you have insulin resistance or glucose, like a high fasting glucose, dyslipidemia, if you have a high lipid profile, if you have an elevated blood pressure, if you have all of these conditions and you cross the line, let's say the borderline, you have a metabolic syndrome. So you can compare yourself with these results, and again, this is for your reference. And this is a comprehensive blood chemistry. Just check whatever you want from these parameters and see what is neutral for men, what is for women, and just depend on them. And this is the bottom line, you read it by yourself, and this is the end of this chapter.